Hi everyone, welcome to the Global Care Courses, which is brought the MRCGP International OSCE Preparatory Guide. My name is Dr. Sufyan Bin Saad. Okay, so obviously already have given the AKT exam and you must have aced it, hence you're preparing for the OSCE. All right, let's just not waste time and hop into what this is all about. So let's have a introduction. So, a short overview. This is actually a two-part exam. AKT, that's the knowledge test. The BCQ, you must have already given that. And there's an OSCE, that is clinical skills, which you're going to be appearing in, hopefully. Right. So basically, you know, uh, the communication skills, the consultation skills is really important in this. Obviously, knowledge is important, but you've been tested for your knowledge in the AKT exam. Now, what they will be testing is the actual basic idea of the OSCE is your skills, how you're going to perform with the patient, how you're going to consult with the patient, how you are taking the consultation with your patient. So, communication skills is the most important aspect of this. If you do not have communication skills, the, for passing this exam, knowledge is not going to be enough. Obviously, with if you have communication skills, you need to have knowledge, but this is the most important thing that is going to be tested. Right. For example, if you have, you're taking your history, like data gathering, examination, management, you're all doing this, right? And you're doing it wholesomely. You're doing everything right. But if you are not doing it the way it is supposed to be done, for example, you are taking history, right? It's when you have to go forward, which we are going to learn in the further in this course. You have to be very careful how you're going to take it. Your introduction, your empathy, your way of speaking, your way of listening, your signposting, all these things are really important. So, and second, the it's you have to be confident in yourself. You need to make your effort, and then you need to leave the rest to God. So we'll see. Now, the important thing is, why are you actually doing it? Obviously, you must be knowing it, but it's just a brush overview. It's very important as now, over the past years, it has got international recognition. Otherwise, MRCGP International was just, exam, just people were just giving like that. But now it has got international recognition. It has opened doors to the Middle East, specifically Saudi Arabia and UAE, right? Specifically that, because now Saudi Arabia is also, has considered MRCGP as a specialist, and in the UAE, what we've heard is that if you have 3 years experience post MRCGP, you are in specialist cadre, which gives a lot of difference in your income. And the most important thing is now Australia, one of the big three, has opened is PEP pathway, that is the practice experience program pathway, in which the Royal Australian College of General Practitioners are giving an opportunity to IMGs, international medical graduates, where they are brought inside in Australia. They have to serve 2 years, and within those 2 years they need to pass the fellow Royal Australian College of General Practitioner program exam, and then they're given this FRACGP, which is a very very good opportunity, right? And UK, with the MRCGP UK International, you're not given a license to practice in the UK, but there is a very very complex pathway which I really couldn't understand, and I had mailed GMC about it. They said you don't have license to practice, but there's a pathway where you can sit in the training, etc., which I really couldn't get it. So there is a chance, but I really can't comment on that right now. What it does, apart from your career path, is strengthening that, it also strengthens your competence. When we did this, we learned all, did the AKT. During practice, it was, we had a different approach to how we practiced our consultations. Now, when we have done this preparation, and we have done the OSCE, we have done everything, you have a real thing that you change your a way of practice in your clinic, right? You make an approach which we will be learning, and that is the very important part which we will be learning uh, in the further classes, further lectures, because it's just not about uh, learning the topics. It's also about how you're going to deal with the topics, and how you're going to approach the complaint what the patient is come here for. We are going to let me make a few things clear over here. We're going to touch the topics, but this is not about gaining knowledge, only gaining knowledge. It's about how are you supposed to approach to that knowledge, right? So you already have your data. You have you have all the things and knowledge that you need from the AQT. But now, how are you going to incorporate in speaking out in front of the patient, in dealing with the patient? That it's what the course is all about, and obviously brushing up a little knowledge. It brings you professional prestige. It personally grooms you as a good general practitioner, right? So basically, let's just also see how the dates and the formats are. It's At first it was only 1 to 2 times a year, and now because of the great demand has increased, it's 3 to 4 times a year. The centers of exams are Karachi, Colombo, Chennai, Dhaka, New Delhi in India, Lahore, Kathmandu, Nepal, and so these are the regions over there. And sometimes Dubai and Cyprus, they are the possible regions. Now, just to orient you with what the exam will look like, there will be about 21 stations, right? And there will be 14 stations which are active stations where you need to do your consultation, and the rest will be rest stations. Each consultation is for 10 minutes. Now, the stations will obviously include the communication skills, the physical examination, the data interpretation. These might be different things, diagnosis and how you're going to deal with that. All these things are going to be there. Right. So, ideally, these are some of the examples of how the exam scenario will look like, the how the exam centers would look like. So, this part is going to be your consultation area where there might be patient, examiner, and you, and this is where the candidate will be standing outside, and this so all these are different. This is where one candidate would stand, this is where the other would stand, here, so on. All right. So over here, for example, you see this is the area where the candidate is going to stand, and over here there will be a data given to you what you can expect inside. So when the bell rings, the candidate quickly comes over here, and there will be written a scenario. So for example, there's Mr. Blue Boss, just a name, Mr. Blue Boss has come here for shortness of breath. Proceed with the consultation. Sometimes there won't be a name given. Sometimes it'll be just a 16-year-old boy is here with a headache. Proceed with the consultation. All right. So over here, like this, right? So this over here will be standing, and these are the instructions, what you have to do. Now, let me tell you over here itself some tricks we already now are starting with, as mentioned previously, that we're going to discuss them. Over here, there will be the data of the scenario given, how you can be preparing yourself from here itself is that the scenario will have just like do the management, conceal with proceed with the consultation. Now when these kind of sentences or phrases are given, you need to keep one thing in mind, that I have to do the examination, right? Proceed with the consultation, give the management plan. So this you need to consider that there I have to do an examination. If Over here, the scenario is written and it says examination is not required. Don't waste your time in any kind of examination. You may ask for an examination. You say, I would like to go with the examination. They will say it's not required, no need, stuff like that. Okay? And don't waste time in that. Secondly, you might also think over here that if examination is not required, this is a counseling station, probably. This is a station which might be saying, that it may be of travel advice. Okay, it may be of travel advice. It may be like, it may be, something like breaking bad news. So these are things that you can consider over here, right? So this is what makes up your mind before entering into this. You can have your brainstorming over here. Now, let me just tell you a few more things. A bell is going to ring. There are two bells before before the consultation starts and before the consultation ends. So what is going to be like, quickly when the bell rings, you're going to stand over here. You're going to stand over here. You have a few minutes to read this. Second bell, you go inside and sit down. And once again, when you are sitting inside, there are going to be two bells ringing. That is one on 7 minutes, where it says maybe 8 minutes, maybe you 7 minutes. It says 3 minutes left or 2 minutes left. You might proceed and figure out and wrap up your consultation, and then you're gonna have a bell ring, which is gonna take you out, and then you can stand outside. So your system, it's gonna be there. They will also give you instructions about that. So I hope you got some point over here. So now, how is the preparation strategy? So obviously you need to master the OSCE blueprint, which is written over here, your knowledge. Obviously it must be complete by the ICT, but we're going to brush it up again in this course. That is the common stations, right? We're going to do the common stations which actually would appear mainly in exams, right? For example, in cardiology, we won't be going into rheumatic heart disease or a lot of inside like um, infective carditis, pericarditis, and all these things, the basic things which might be appearing in the exam that a GP must have mastery in it. And then obviously the communication skills. The most important thing is practice. You need to practice, practice, practice. We do it with your peers, you do it on any kind of patient, and you think that this is and you feel that, oh, this is my exam, you're going to take it, you can take out 10 minutes and do it with the patient. You need to manage time. All right. And the most important thing is confidence. Don't be overconfident and don't feel underconfident. Look and feel confident with balance. Managing time is really important. And in the upcoming scenarios and things, we will be speaking about that as well. If you say about managing time, what is suggested that first you keep 7 minutes in mind, right? When you're doing a consultation, time yourself with 7 minutes and see where you stand, and try finishing up in that, right? So this is important in that, say, and then when you the first few consultations where you've just begun, if it doesn't end in the provided time, whether it may be 10 minutes, you've timed yourself as 10 minutes and it's not finishing in that time, don't worry and complete your consultation. Become a judge of yourself and see, okay, I have not finished in time, but am I getting the scenario done? Am I getting the management done? Have I done the examination appropriately? Have I fulfilled all the things which are required for the consultation? So this is what you need to be aware of. So this is what the thing is. You need to acknowledge your communication skills. Communication skills, very, very important. You need to practice, 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 manage your time, and just feel confident. Okay. Now, this is an aspect which I really, really, really believe in. everyone should believe in that. Everyone having faith is a person which will keep this kind of mindset, the belief set. Yeah, and you know what you're going to do. You have to believe in yourself. I keep on repeating in that. Your faith is important in this. You have to do is what you have to do is just effort, and with appropriate blueprint that you're going to follow. And you just have to work hard, and that's it. Work hard and work smart. That's important. Allah, God, He does not waste the reward of the doers of the good. When you're doing something and you're doing it with good intent, you're doing it with effort, He won't, just leave it like that. And when you've done effort, and when you've done everything good, and you're putting in 100% in it, and if it's not happening, something better is waiting for you. Remember that. So now what we've done, we're gonna be with you. We're making a goal. We're gonna plan how to do it and then execute it. If there's a goal and that's a plan, there's no execution, you don't need to do it. What is the goal? You need to do MRCGP. What is the plan? Okay, how am I gonna do it? I'm gonna take some time. I'm gonna do November attempt. Okay, I'm fine. I can do it. I'm gonna do March attempt, and then you need to book your exam. That is your execution. You need to take the course. That is the execution. You need to practice. That's your execution. That's a path of execution, right? So what we need to do is we're gonna set some smart goals, right? Smart goals. Example: by next month, I will confidently present serious exam under 6 minutes, right? And then we need to reduce that time, obviously, because CVS or any kind of examination shouldn't be taking that long. The whole consultation is 10 minutes. So then 6 minutes, I'm going to do it, and then I'm going to come to 4, 3, and in maybe about half or 2 minutes examination or 3 minutes examination should be done. And then you need to track your milestones. All right, my CVS examination is done. I have done my CNS. I have done my consultation skills have become good. Am I speaking properly? Stuff like that. And obviously take a critical feedback. You need to take a critical feedback, right? If you're not having critical feedback, the negative things which are happening in your consultation won't be there with you. And self-review yourself and daily say, I can do it, I'm doing it, I can, I will. All these things will, reinforce your mind to think that way, and your mind will work for you. Things which are, going for like maybe happening in 15 hours, you'll get it done in 10 hours, then you'll get it done in 6 hours, and stuff like that. Your mind is really strong, but you need to mold it. You need to mold it. Your mind is like elastic. Your mind is very it's moldable. How much ever you mold it your way, it will act accordingly, right? So focus on efforts, leave the outcomes to Allah, leave the outcomes to God. Practice, practice, practice. That is the most important thing, my candidates. All right, so kick off the communication skills, the most important thing that we have to do. All right, so kick off communication skills. Let's start with it. You're gonna have fun in this course, hopefully, right? So just keep focus in it. Don't worry if you're not able to understand anything. Not an issue at all. Pop a message in the WhatsApp group. We're gonna all answer your queries. If you're not getting something to you're not understanding, just don't worry about it. All right. So communication skills. Here we come. So the most important thing of communication skills right now is the history taking. How you're going to take it, right? So the soft skills, and then why it matters, and some examples we're going to give. So when you are starting a consultation, you're sitting down. The most important thing, what the examiner is going to look at, is a posture. How your posture is. Is it just like how usually we have in our clinics? Arms are folded. You're on your chair, leaning back. Not looking at the patient. So these things are very important. Your posture and how you are greeted. right? So it should be hello, right? Hello, I'm Dr. Ahmed. Hello, I'm Dr. Paul. Hello, I'm Dr. Suniti. May I know what your name is, please? And then, how may I help you today? Right? So you start with hello, your name, and this is just an example, right? You can do it your way. Hello, I'm Dr. Sufyan. I'll be your doctor for today. How may I help you? Or what brings you here today? Or what's bothering you today? So things like that. Whatever you want, but it should sound really nice. Because the first impression really matters. So what you're gonna do is keep yourself really confident, open your shoulders up, warm smile, and then your posture should be stooped, looking at your patient, having a good eye contact. You should have 90 degrees, all right, 90 degrees with the patient, one arm distance, stoop towards the patient, and listening very carefully, right? So it's very important. Stand tall doesn't mean you need to stand. It's like you should be very confident. Open shoulders, it means that you shouldn't be having a very just sitting like that, your arms folded or something like that. You should be sitting very confidently, stooping. I'll share some pictures with you, right? So this is just an example. Hello, I'm Dr. Ahmed. May I know your name, please? Like that. You should be something that just your patient is everything for you. Your patient is everything for you. Very polite, and maybe you just when you have greeted them, and when you are looking towards them, they feel really relaxed, and they open up to you. In the coming consultations, in the coming topics, we will be seeing what different case scenarios where the patient doesn't want to open up, but because of this posture, because of these greeting, they will come up to you and then give out every information. Your tone in speech, use a very gentle, calm tone. Speak at a natural pace. Example: if the patient is not speaking to you, all right, take your time. I'm here to listen. Don't worry, right? We are doctors. We keep confidentiality. All your data, all your history that you are telling us is going to be kept only between us. Stuff like that when a patient is not speaking, right? So then they open up with you, like this: empathy and emotional awareness. For example, when a patient tells you something, yeah. So, for example, you say, "Hello, I'm Doctor so whatever the name is, may I know your name, please?" They tell you your name. That builds a rapport, right? That makes the patient speak up a little, and then it brings ease to them. All right, this doctor is here to help me. So how may I help you? So, right? No. So the patient not speaking, you should say, take your time. I'm here to listen. And then when a patient says, "Oh doctor, I'm suffering from abdominal pain. Oh doctor, I'm suffering from chest pain. Oh doctor, I'm suffering from shortness of breath." So you just say, "Oh, I'm really sorry. You have to go through that. It must be really difficult. Oh, I know. It must be a lot of pain. Oh, I understand. It must be difficult for you." So this is just an example, and you can tailor it according to you. Then avoiding medical jargons. For example, speak in everyday terms to make understandings between yourselves. So instead of hypertension, you say high blood pressures, right? So body language should be very important. Open posture, nodding, eye contact, leaning slightly forward. So open posture we discussed in the above posture and greeting. Nodding is like when the patient is saying something to you, you're looking at him and her, and you're nodding your head. That means you're listening, and the whatever things they're saying, you they feel that they have your affirmations in that. Eye contact is very important, right? You're looking at them and leaning slightly forward. That means you are very attentive to them, right? And maybe you must be feeling that, "Oh my God, what is the Dr. Sufyan saying? Always it's too much for us." No, no, no. It's going to be easy for you. Don't worry. And sometimes I may be emphasizing a lot on stuff, but this is what actually is very important and is going to be there for you. All right. So I really apologize for too much information. But the thing is, what I want for you is to get everything, but individualize your needs, right? So if you know this bit, you don't need to put it in your head. Just listen to that, or just increase the speed, but listen to that, all right? Don't skip it. Just listen to it or increase the speed where you have it in your ears, but you don't have to, worry about it. I'm gonna keep on, reaffirming all these things in the near coming lectures, right? So these are the important things: your postures, your tone, your empathy. Empathy is really important. Medical jargon should be avoided. Simple layman language like diabetes should be into high blood sugars, right? Shortness of breath is okay, but you don't have to say dyspnea, right? You don't have to, let's just see how history thing goes ahead. I'll tell you why, right? So this is very important. So in this red line below, avoid crossed arms. As I told you, staring at the notes. Don't stare at the notes first, or don't turn your patients to the back. Don't use medical jargons. Don't interrupt the patient at all in the first minute. All right. Don't give, have any blunt answers to the patient. Don't touch the patients anytime apart from examination, and that also should be very ethical, uh, touch for the patient, right? So these things are very important. Now, in the thing that I've told you, active listening is important. That the patient feels that you've engaged with him. So when you have to say something to the patient, or the patient is finished, say these things. So if I understand correctly, or if I understood correctly, you're worried that this could be something serious, right? So these kind of things that is showing, like, you're listening and the concerns, right? Shared decision making. Involve the patient always. Don't be a doctor centered approach. Make a patient centered approach, because you are there for the patient, right? So involve the patient in every matter, in all the plans, in all the management steps that you're going to take. So, example, if you want to say about your the pharmacological measures, your non-pharmacological, you say, all right, so would you try preferring your lifestyle changes first, or shall we discuss starting a medication? So, just give a question to the patient to involve them, right? You don't have to just say, all right, I would like you to walk. I would, for half an hour at least, you should do this. Okay, you should take good green vegetables. You should take low fat diet. No, 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 no. You need to say, right, how about we try some low fat diet, right? And how about reducing your salt? Does that sound good? Stuff like this, right? So take these phrases, try to incorporate them in your consultations. You can tailor it, you can do anything, but it should sound good, right? Right. So the important thing is culture and sensitivity. Sensitivity is very important. You need to respect every faith, gender. There is no gender, there is no religion in this. So it's very, very important. So if there is a female patient, so you should say, would you feel more comfortable if a female colleague joins us, right? So stuff like that. Conflict resolution. If there is a very angry patient, you need to ask him. You don't have to be rude, you don't have to be angry, you can be assertive, and you need to just calm them down, and you need to stay calm for calming them down. Stay calm and be non-defensive with upset patients. Example, I understand you're frustrated, let's work together to find a solution that works for you. Or you can say, I do understand. I'm here right now. I'm going to try helping you. But if you won't calm down, or if you won't come with me, or if you won't sit, how am I going to help you? Please try to understand. Stuff like that, right? And be confident without being arrogant. Show calm assurance without ego. Based on my experience, I believe this is the best next step. But I'm happy to explain further or hear your view in it, right? So this should be very important. Like, for example, a patient says, "Oh, no, 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 this is not. I have heard this. I have heard that." So you say, "No, no. So I believe this is the best next step, but I'm happy to explain further or hear your view." If the patient says, "No, no, not like that," what you can say is that, what I'll do is, for your for you to become satisfied, or for you to become relieved, I will take a second opinion right now, and so that that we can have we can come to a same point. So stuff like that. See, what the most important thing in MRCGP is patient centered, being patient centered. It's very important to be patient centered. For example, you're a slave, you're enslaved to the patient, all right? So, and whatever thing is, this is you may find it funny, but you have to act in it, right? You have to act in it. You have to solve the patient's problem, whatever the thing is, right? Whatever the thing is, you have to solve the patient's problem. For example, there is I went into an OSCE, and I there was a candidate, and it was lovely, listening to their answer. There was incontinent, stress incontinence, and with a benign prostatic hyperplasia patient, right? So in that, he was a rickshaw driver, right? Rickshaw driver, and he said, I become incontinent, my pants get, sort of dirty, and I'm very concerned about that. So what should I do? And stuff like that stuff. So we just gave him that, told that the candidate told that, I do understand it's really difficult, but the thing is, what we're going to do is we're going to give you tell you to wear some diapers for the meanwhile, or you can keep a little cloth so that your pants don't get wet, and then you can change them. What and unrealistic, sometimes it's unrealistic. Like, for example, what we are going to do is that, don't worry about the expense. We can do it at our cost. We do have some funds for patients like you, like these, just making the patient happy, just making the patient happy. So you need to take out solutions, right? So there are going to be certain situations. I'm going to keep on considering them, discussing them with you, right? Okay, so now what you need to do is, for today, you need to practice with me. For the first lecture, you need to practice with me. The key words, what we need to do before in starting of the consultations. Hi, my name is Doctor. Can I know your good name? Doctor, whatever your name is, right? Hi, and then, may I help you today? Or how may I help you today? What brings you here today? Today I'm going to, be your doctor. Can some stuff like that. It's up to you. You need to show empathy after introducing yourself, and the patient gives his or her complaint to you. You must say, oh, I'm really sorry to hear about that. I understand it must be difficult. Tailor this according to yourself, but practice this. Keep on saying it. Use a mirror, and use any mock patients, use your relatives, use everyone. You can tell them. For culture barriers and personal questions, it is very important to signpost, right? Very important. So if it's okay, may I ask you a personal question? Example, for menstrual history, for sexual history, for addictions, you need to ask these questions, right? So if before asking these, you need to signpost, you need to tell them, okay, now there's a personal question coming. So is it okay if I ask you? And do not put it on the patient like, I'm going to ask you a personal question. No. If it's okay, can I ask you a personal question? There's a personal question I need to ask. Can I ask that? So may I, is it okay? Stuff like these. These are the words that you need to use. These are very important. If you're not going to ask this, then your examiner won't give you good marks, which is very important. Ideas, concerns, and expectations. These are very important things. When you have done you start your history by saying, hi, my name is Doctor, that is introduction, my name is Dr. Sufyan. Can I know your good name? And it's like that. And then, how may I help you today? If you do not want to ask the, you don't need to, if you don't want to ask the name, don't. But then you can tailor this according to you, but you need to do it because you have to address the patient. The more you address the patient with their name, the more comfortable they become with you. So, for example, hi, my name is Dr. Sufyan. Can I know your good name? Or the patient says, my name is John. So, how may I help you today, John? Like that. You need to be very personalized. The patient should feel that, my God, he's only concerned about me. So, oh, I'm really Sorry to hear about that, John. It must be really difficult, right? So then signposting, if you come onto these, so you ask the personal, the history of presenting illness or history of present complaint, then the past history, medical history, past medical history, surgical history, family history, drug history, what medications is he taking, allergies, right? Surgical families, allergies, and then you come on to the addictions. When you come to the addictions, you say, "Oh, John, if it's okay, can I ask you a personal question?" Right. Okay. If there's a sexual history, say, "Oh, John, I need to ask a personal question. Is it okay with you?" Right. So stuff, keep on doing like that. Take the name, right? Take the name of the patient. Oh, and when you're finished with this, when you finished with your history, that is, past medical history, surgical history, family history, drug history, addictions, allergies, m- your social history, mood is very important. You need to ask about the mood as well. Okay. After finishing this, summarize, right? So, so what this previous slide, like this one, uh, where is it? It says that uh, for example, from what I've heard, right? So from what I understand, you're facing this. You have this problem. You are having so, and you've told me about you taking this medication. You're taking this medication. So stuff like that. So you need to ask then at the end ideas, concerns, and expectations. So what do you think is going on? So right, so the patient tells you, and what concerns you the most? Like this is the concerns, and then you ask them, what would you like me to do for you today? So that's what is going to tell you what the patient really wants, right? Sometimes the concerns are addressed in the beginning, right? I'm really worried. I'm really worried that I might die because I have my father died as well with a heart attack, right? So this is the concern might be addressed in the beginning, so you don't need to ask it again, but then you can just brush on it and you can just touch it. I do understand you are really worried about your that you're dying about with this problem. Is that so? That's a question about concerns, and this is what you have to do, right? Now, shared decision making is very important, right? So based on the history uh, and the conversation that you've already had, so it at the end when you've summarized, you've done the examination, you just need to give this phrase. I think you must be suffering with an illness, so and so. I think you must be suffering from an illness called as COPD, right? COPD. Have you ever heard about this? Because you're using a medical jargon. The patient doesn't know anything about it, right? So then you can say, I think you may be suffering with an illness known as COPD or chronic obstructive pulmonary disease. Have you heard about that? Patient says no. All right. So chronic obstructive pulmonary disease is in our language, in the medical language, when the airbags are they do not inflate properly, or they have been obliterated. They do not blow up properly, something like that, right? They do not inflate properly. So you can even draw it. Okay, it's examiner really good gives good marks when you are actually trying to show the patient what he is or she is suffering from, right? So I think you must be suffering with illness known as heart failure. This is when have you heard about that? No, right. Heart failure is something when the heart stops pumping properly, right? So, but the good news is that we are going to treat you, and we're going to give you medications, and hopefully this could make this better. False hopes are not good. Like when you have a treatment, really good, but false hopes, for example, you're telling about some kind of pancreatic cancer. All right, CA pancreas. It doesn't have a good mortality. The mortality rate is really high in that, right? Prognosis is not good in that. You can't say, "Oh, we've got treatment. We'll do radio. We'll do chemotherapy." No, man, the patient's gonna die within less than years. So it's very difficult. So you don't have to give false hopes, right? You have to be very realistic, right? So this is what the thing is. For example, even with small things like hepatitis C, when you've got hepatitis C surface antigen positive, anti-HCV antibodies positive, you need to go up with the bigger test, right? But you don't have to be very enthusiastic and say, "Oh, this is a small test, and hopefully your bigger test will be negative, so don't worry about that." No, 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 no. You don't have to do that. Don't be over enthusiastic until unless you're sure that you've got a treatment for that, right? And then when you've told the patient says no, you explain what the disease is, and at the end of your explanation you say, "Are you with me?" So this is shared decision making. This is patient centered approach that you keep on asking the patient in a while when you're explaining or when you're telling about the pharmacological or non-pharmacological things. You're saying to them, "Are you with me? Do you understand what I'm trying to say?" So this tone is very important. The words are very important. So this is the communication skills. If you do not have them, your knowledge is of no use. Okay? So are you guys with me? I'm asking, are you guys with me? All those who are listening, right? So you should be with me, right? So when you've done that, when you are making a decision about the management, pharma, non-pharma, when you are giving management, like, what we'll do is we'll try walking, for example, if it's caused diabetes or hypertension, we'll try to exercise. We will try to exercise. This is we is very important. We will try to exercise at least half an hour daily. What do you think about that? It's good. Like this, you need to ask the patient like this, right? And what about, let's try to reduce our salt intake. We'll reduce it because the high blood pressures can lead high salt intake can lead to high blood pressures. So how about reducing it? What do you think about that? This is what we need to talk like that, right? So I hope you guys are getting me. Please let me know if something is not working out for you. I will be really glad to help. All right. So this bit was really important. So now the consent before examining and informing every other step. It's asking about discomfort. Are you okay with this? I hope you're feeling comfortable. Are you okay right now? These things are really important. Okay. For example, a patient comes with really bad chest pain. Oh, are you okay? First thing you need to do is you don't need to introduce. Maybe, hi, my name is Dr. Sufyan. Can I know your good name? You ask him, how may I help you today? You just say, oh, I have a very hard chest pain. I'm feeling very difficult. You need to act quickly and say, are you okay? Would you like to come to the couch? Right? Would you like to come to the couch? Even if there's no couch, you just tell him, would you like to lie down? Would you like to be more comfortable somewhere? Or are you good in the chair? The SP, that is the one who is there, the patient, is going to guide you. They're not there to fail you, my fellows. They're not there to fail you. They want you to pass. But then you need to go into a little bit right track, but they will take you towards the right track. Right? If you move off track, they will move off track, obviously. So don't worry about that. Everything's going to be fine. So you ask them, are you okay? Would you like to come to the couch? Is it okay with you? All right. And then if you think that their chest pain is ongoing, it's not getting better, you need to say, I think, or any, let me just get some workup. Let me get an ECG done for you. Like, you need to act according to the patient. If he's having arm pain, if the patient is having arm pain, they say, are you okay? Is it okay? You say, yeah, doctor, but it's paining a lot. You say, you know what? What I do is I'll just give you IM injection for your arm pain right now. What do you think about that? Do you want it? If he says yes, then you give them. Just say, okay, I'm going to tell the nurse to give it to the give you an arm pain, and then we can continue. How about you sitting on the couch? Is it okay, or you're fine over here? So stuff like that. So the patient is going to guide you. You just take it very naturally over there, right? Hope you're getting it. So consent before any examination. Inform about the every other step. For example, you are taking vitals. You say, okay, I'm going to check your blood pressures now. I'm gonna check your temperatures. All right, are you okay? And then I'm gonna before auscultating, before touching for palpation, say, okay, I'm gonna touch your stomach. If you have any pain, please just let me know. All right. So these things are very important for you to ace the MRCGP, or I think any GP exam. Okay. So just asking everything. So I about so that's what I already told. Offering to make someone, sorry about the Q, MAKE, make someone comfortable in painful situations. Example, offering them a couch when in pain, analgesia, as I already discussed, ER referral. You need to tell them, because if someone you there with an MI, you tell them, we need to refer to the ER. Is it okay? With, consent before them, and I'll tell you the scenarios how you need to counsel the patient. Being a safe doctor is a very good doctor. So I think we will do this history taking in the next lecture. For now, it's enough. What I want you to do is practice about these things, and then when we're history taking, we can incorporate these things into the history taking. All right. Uh, so I hope these things are clear for you. Jazakallah khair. Assalamu alaikum. Until the next lecture. Bye, guys. All right. So history taking, right? So history taking is the bit where we need to ask about the questions. Now, what are the questions going to be? They are the ones from what we start our consultation, so that we know what the patient is suffering from. We can solve the patient's problems. So remember, in the first bit, approximately around 1 to 2 minutes of the consultation, let the patient speak. This is what the opening questions are supposed to be. So, as we've discussed previously, introduce yourself. That is the meet and greet part. Hi, my name is Dr. Sufyan. How may I help you today? Or whatever you have tailored in your meet and greet. And then let the patient speak. For example, the patient says, "Oh, doctor, I have cough." And then the patient stops about that. So you need to be very open and tell the patient, "Can you tell me something more about that?" Right? So tell me more about that. Then the patient opens up with you, and the patient tells you, "Oh, yeah, doctor, I've been having it since so and so much time, like maybe 3 days, and then, cough like maybe 2 weeks and 3 weeks, or, plus minus the duration." Right? So, taking the cue of that, you need to proceed with the consultation. Okay. So now when the patient stops speaking, he might or she might have given you a lot of information. And then to take the consultation further, you say, "All right, if it's okay, can I ask you a few more questions?" And then you open up with what you have to ask, which is relevant to the case. Currently, we're just taking cough, so we can just go ahead with that. Like, so when you're taking this further, within the first 3 minutes, if you have the knowledge, you can make differential diagnosis in the 3 minutes. And the way you are asking the questions, you need to portray it to the examiner that you are, making differential diagnosis, and then you are narrowing it down towards a provisional diagnosis. I hope you're getting me. We will just discuss this with an example, so it'll be clear for you, a little better for you. All right. So first we go with the open questions. Tell me more about that. And when the patient finishes speaking or doesn't want to speak more, then you can go on. If it's okay, can I ask you a few questions? So the SP in the exam will always want to help you. So they'll just give you initially limited information, and when you want to open them up, you say, "If it's okay, can I ask you 4 more questions?" And before that, tell me more about that. Tell me more about that. The SP opens up. When he stops, then you say, if it's okay, can I a few more questions, right? And then you go towards your differential diagnosis. First 3 minutes, differential diagnosis is important. All right. When you're making your differential diagnosis, rule out your red flags, because the patient might be having something which is serious, and you need and want to rule out the red flags in itself. So when you're making the diagnosis, it must be overwhelming for you while you're listening to this. But as I told you previously, it's all about acting. You need to act out and show to the examiner that you are asking the right questions at the right time, right? So make your differential diagnosis and show it to the examiner. Now, you do not have to ask all the questions. For example, if you say cough, you're gonna open up the boxes of cough, right? You're going to open up the boxes of cough. Now, cough may be related to a different systematic manifestations, right? So it might be a cardiac cough, it might be due to a respiratory cause, it might be due to deconditioning, it might be due to anemia where you're feeling shortness of breath and you're having a cough. So all these things. So you need to narrow down these with little questions. You don't have to ask them very long questions, then how are you going to finish the consultations? So you need to act it out, right? So I'll just give it a few examples which might make it clear to you. So when you're done with your questioning, we're done with ruling out differential diagnosis, you have a provisional diagnosis in your mind, then you go on with the past medical and surgical history. You need to rule out, cover each component of it, but you need to be very quick with it, all right? Because as I told you, SP is going to guide you. So when you're asking this bit of the history, you say, do you have any history of any long-standing illness? Or because you not need to use medical jargon, so you say, do you have any long-standing illness in the past? All right. So this will help you cover this, right? And have you been ever admitted in the hospital? That will obviously someone with needs to be in the surgery, he needs to be admitted. So they'll tell you about that. And if they don't tell you, you're not going to be caught for that. Okay? So this is the bit. Then you ask about the family history. Family history is very important in most components, and you need to ask about it. So anyone in the family who has suffered to a similar illness or any other illness, right? So things like that. And you need to be very careful while asking about the history. For example, when you go and you ask, have you ever suffered from any long-standing illness? So the SP might say, like what, doctor? You say, right, like high blood pressures? He says, no, doctor. Like, high blood sugars? He says, no, doctor. So like these things. And when you've actually asked the question, any long-standing illnesses? So if he says no, then that's good. Fine. In the family history, have anyone in the family suffered from any illness? You do not you used to ask something which is like, have you ever suffering from any disease? Very layman, simple terms, right? Then the medication or drug history is very important. Have you been on any medications? Don't use the word drug. It's just for you, and I'm telling you. But have you used any kind of medications, right? Are you suffering from any allergies, right? And pause, and every aspect of these the components of the history, pause, right? And let the patient seem to understand that, absorb it, and speak it out to you. Okay, now this bit is the signposting bit. Addictions, right? Addictions is the signposting bit. You need to stop here and need to ask, is it okay if I ask you a very personal question, right? And he says, yeah, doctor, no problem. So you say, uh, have you been in some sort of addictions, right? So like what, doctor? Maybe like smoking, right? Or consuming alcohol. So if you have asked about addictions, it will be covered. If you have asked addictions, it'll be covered. So if they're hiding something, you wouldn't be caught about it. But it's better you can dig it out. Now, psychosocial. Mood is very important with it, right? Mood is very important with it. How's your work? How's your diet? That's important. You need to ask about the psychosocial. Sorry, is typo, spelling mistake over here. So psychosocial history is important, because specifically if it's a case of depression, if the patient has low mood, the diet is related, the sleep is related. If the work environment is very stressful, you need to cover that. So these, what you're saying, what I'm telling you all these in detail, you don't need to be overwhelmed. When you start practicing it, these will all fall in place. So don't worry at all. Now, the component that we discussed, when you have finished all these things, you do a little bit of summary and you ask them, so you have been suffering from this, and you don't need to summarize each and everything, right? You don't need to summarize like addictions. You don't need to summarize with allergies, right? So just say, for example, there's cough. Okay, you have been admitted once in the hospital, and yeah, currently you are on so and so medications, and if it's relevant, use the stuff, other stuff. If irrelevant, just use the positive things which you have found in the history. So after you've summarized it, you can so what do you think you're suffering from? Okay, so this is the ideas. And then, what is the most important thing that you want me to do for you today? Or you can tailor these sentences. How may I help you today? Right? So this will be expectations. And what bothers you the most will be their concerns. Summaries, as I told you before, right? So sometimes people come with a complaint, but actually they are worried for something else. For example, they're coming for cough, and when you ask about their concerns, they give you a history which they haven't given before. Because I'm concerned because my father was having the so and so problem. So you can say, oh my god, I forgot family history. So maybe his father is suffering from this. So you get a family history from that if you have forgotten it. So these are the things which are very important, right? So this is the example which we're just going to discuss, and hopefully is going to clear many of your things. So for example, as I told you, we're taking cough. First of all, look at the things which we need to ask and rule out. We need to rule out the respiratory symptoms. We need to rule out the cardiovascular symptoms. We need to rule out the gastric cause, the deconditioning that's overweight, or hematological cause, right? And very, very little um, uh, the little questions which you need to ask. Not much, right? So when you got, oh doctor, I have cough. So then what do you say? Remember? Yeah, you remember that you say, oh, I'm really sorry to hear about that. I know it must be difficult. So can you tell me something more about that? He says, yeah, doctor, it happens to me mostly in winters. And then whatever the patient is start to say, he might be giving you much information which is over here. So you can narrow down it with these questions to the specific system, right? If not, then you can just ask, okay, so if it's okay if I ask few questions, says, yes, doctor. Do you have any phlegm with it? Okay, and what about any whistling sounds? Okay, that's the thing, and that's it. You will get into the chest signs, right? So so these are the red flags that for each uh, of for each system you can ask. Weight loss, nighttime awakening, because weight loss and might lead to because of tuberculosis, phlegm. You can ask, if he's got phlegm, then you ask, I hope there's no, do you have any blood in it? So, that could lead to tuberculosis, and then you can narrow down your diagnosis. So, if you've got CVS, okay, so chest pain, you need to ask chest pain, and feet swelling, and paroxysmal nocturnal dyspnea, so that leads to heart failure. So, these are the questions you can ask, and that's it. And what about any acid rash? An acid rash, you won't ask like that, right? You will ask that, do you have any burning sensation in your throat while you're sleeping or anytime? These are the things, right? So then he says, no, doctor, you can rule this out. Nothing like that. And if you ask about, no, I don't have any burning sensation in my, chest or something like that, you can rule this out. And then just ask the other questions where he says, yes, doctor, you will definitely understand. If you have the knowledge, you will definitely understand and you can get to the diagnosis. And all these bits, it's very easy. You can just keep asking in routine, and it's going to be very fast. You won't have to worry about it. If you practice, everything is going to fall in place. So this is the first 3 minutes. It's going to be easy. The first minute, let the patient speak, and then you can when he comes, you say, I'm suffering from this. You tell me more about that. And then when they tell you a little more and stop, you can ask if it's okay if I ask you a few more questions. You jump into making a differential diagnosis, rule out the red flags, and then you have a particular diagnosis in your mind, but you need to cover these components, summarize it, ask about the ice, and then you can go on towards the next part of the consultation or the management bit, that is the examination. Okay? Now, examination. I hope you've got the history. Don't worry, we're going to cover it in the topics, so it's going to be get cleared. And because the lectures are recorded, you'll get it. You can keep on going it again and again, and do not forget that I'm there for you. Just send in the messages, send in your questions. I might get late, but definitely you're going to get answers. We're going to do this together, my friends. We're going to do this together. Don't you worry about it. Okay. So examination, the first thing is hand hygiene. You wash yourself, and if the part is only about examination, you tell them, okay, so my name is Dr. Sufyan, or someone, so I'm going to examine so and so part, right? For example, if it's chest, I'm just going to have a look at your chest. I'll look at it, I'll feel it, I'll put the stethoscope. Is that okay with you? He says yes, so proceed with that. All right, then you need to place the patient correctly. Keep in mind that the limited mobility of the patient is the best examination. For example, you're doing a chest examination. You might want to keep the patient once and for all in the sitting position and once and for all in the lying position, because you will need to auscultate the chest. So you can just auscultate the chest from the front and the back in the beginning, all right? And then you can make the patient lie down. Or because obviously you might want to look at the chest expansion, everything, you just make the patient lie down and do the auscultation when he sits up, and then get him out of the couch. I hope you understand what I'm trying to say, right? Don't keep the patient moving up and around. First you're making them lie down, then you're making him sit up, and then you're making him lie down. That's not the right thing to do. Okay, positioning of the patient is very important. And it's very important, if you have a different gender patient, you need to get a chaperone, right, if needed. And you ask the patient, are you comfortable, can I proceed with the examination? This politeness and the way of speaking, conversation, communication is very, very important. That's what if the patient is having pain, you rather stop the examination in between and ask them, because they're giving you cues that, no, I don't want further examination. So, right, if they say, no, doctor, please don't touch me, it's very painful, doctor, so you stop. You ask them, is it okay, can I continue the examination, or I'll stop in between, don't you worry. They will give you the cues, so it's going to be easy for you. You're going to ace the exam. Now this is just an overview. So you need to in the cardiovascular, in the respiratory, in the abdomen, neuro, and the musculoskeletal joints. These are the components of that, but you need to be alert that you need to do focused examination. It's not an internal medicine exam where you're going to check both the pulses. You're going to check all the pulses, and all that stuff. Yeah, the examiner will just look at you that, okay, you know what you're doing, right? Are you getting me? So, for example, it's a musculoskeletal system, right? You don't need to get into excessive general physical examination. Obviously, you will start with the vitals, but no excessive general physical examination, just relevant to what it might be leading to, right? So musculoskeletal, you're just going to do these special tests, all right? And for example, it's a chest examination, respiratory disease. You just need to do specific tests which are required, right? For example, in COPD, you just need to auscultate the chest. You just need to check out the asterisk sign, because there might be into a CO2 retention. Just check the pedal edema. We will discuss that in the coming topics for the special tests, because time is limited, and you might just move on because the examiner is going to see that you've done your bit. So you have to save a lot of time. Okay. So read the scenario carefully, focus on the relevant systems which you have to do. Don't just keep on doing everything. Be very systematic. Don't skip the key steps, the important steps that you need to do. And at the end, summarize the findings and be allowed what you are going to do. Just keep on acting. Okay. For example, you're doing respiratory examination. Okay, I'll just take your vitals. All right. That's good. Thank you so much. I hope everything's fine. Then you go, I'm just going to touch your chest so that you can palpate, or you can do the vocal firmitis test, right? I'm just going to listen to your chest and take a deep breath like this. So ask these things and summarize yourself, right? And practice regularly. Time management is very important. Think aloud. Don't worry when you're speaking aloud. Stay calm, stay empathic. Everything is going to be fine, so don't you worry about that. Okay. So today you need to practice speaking with your communication skills. Incorporate them in your history taking, in your examination. Stand in the mirror, keep on repeating the sentences which I have discussed. Tailor it to your own comfort, right? It's not necessary you use my script only, but how you get comfortable and it sounds good, and it sounds polite for the patient. And in the further coming topics, we're going to discuss it and how we can do it. Okay. And so you don't have to worry. And please do give me your feedback if something is lacking in what you think I can improve. I'll be more than happy to discuss that with you, and then we can do it. If I'm going too fast, if I'm going slow, if the voice quality isn't nice, you can just tell me, and then we can do it. And don't worry, in between we'll be doing some live sessions as well, so that all the queries are done and all the things can be incorporated. So just don't worry at all. Okay.